caregivers are probably more important than the healthcare system that gets most of the attention and credit. Um, you spend maybe at most 30 minutes every couple of weeks seeing a healthcare provider. You spend 24/7 with their friends and family who take care of you, who make sure you get to that appointment, who make sure that you watch the diet as you're supposed to, who make it possible often for people to live at home independently. A lot of the patients I take care of have these enormous and enormously complicated social and assistance networks that make sure that somebody checks on them frequently, helps them with shopping, helps them with laundry, helps them to stay safe. People who probably a year ago without that would have wound up in a nursing home, but are managing to live at home because of all that support. So I think it's a support for patients with serious illness that we can't take for granted. It's also a source of support that's uncompensated, except in rare situations, I think unappreciated. And I think it's a real asset to the healthcare system that we either ignore or take for granted far too often. Yeah, it's kind of hard to make a list. I'll just hit a couple that seem to come to top of mind for a lot of my patients and their caregivers. Not necessarily in order of importance, but certainly financial burdens, either because of the cost of providing care, the cost of making changes to a home, for instance, to accommodate somebody with serious illness. But I think the big one often is the way that patients and their families wind up going into debt for the healthcare that they need. That plus lost days of work and often lost jobs for caregivers who can't take care of an aging parent and hold down a full-time job and take care of 3 adolescent children. And so, something's got to give, and often what gives is that job, which puts people, families in a bad financial situation. Healthcare is still one of the leading causes, if not the top cause of bankruptcy in the United States. And that's not surprising, given all the time and energy and work this requires. We don't have a system, unfortunately, that either reimburses caregivers for their help, or that at least makes it possible for them to hold down jobs and be productive and independent themselves. It's really, I think, a difficult situation when caregivers have to choose, as they often do, between having a job to put food on the table for their family versus staying home and taking care of a relative with serious illness. So certainly financial burdens are significant. And physical burdens, just the challenges, logistics of managing care. How do you drop the kids off at school without leaving your aging parent with dementia alone? And how do you make those sorts of trade-offs? And how much risk do you want to accept leaving your aging parent with dementia home alone for an hour so you can take your kids back and forth to school? Or do you homeschool your kids because there's no way to do it? I mean, families make these sorts of choices all the time. And they're really tough choices with unfortunately no great answers. And then the other burden I'd highlight briefly is just the physical burdens of caregiving, particularly somebody with dementia who is up at all hours of the day and night. Interrupted sleep is pretty common, if not universal, for caregivers, unfortunately. And then sometimes just physical burdens, challenges of providing care. I've taken care of a lot of patients who are older men who are 200, 250 pounds, now have serious illness being cared for by frail women, their wives. And it's not just taxing physically, but it's also dangerous for somebody to be helping their spouse into and out of the bathtub, for instance, when their spouse weighs twice as much as they do. That's how serious injuries happen. And yet often caregivers are asked to do that because we don't have ways of providing the kinds of support that patients, caregivers, families really need. A lot of that burden falls to caregivers, and their physical health suffers as well. So that's not a complete list, but just top of mind, those are some of the things that I seem to see a lot. three suggestions I always make. One is to be as organized as you can be about medication administration schedules, whether that's creating a days of the week pill box that you fill up on a Sunday night that lets you track what medications are supposed to be given when. And they make them those boxes with timers or cues to make life easier. The second, maybe the first in a related way, is subscription pharmacy services. PillPack is one a lot of my patients use, but there are plenty of others that provides pre-packaged medications. So this is what you take at 8 a.m. on Monday. This is what you take at noon on Monday. In individual pouches that you open. It becomes really easy both to administer those medications. It becomes actually fairly easy for even patients with moderate dementia to self-administer those medications with the right timers. And it also makes it possible, which as caregivers we all know comes up, makes it possible to see when doses are missed. You know, if it's Monday afternoon and you still see that Monday morning 8 a.m. pouch sitting on the counter, you know that you missed a dose or two or three. And then last but not least, that's all an attempt to organize medications, but you can't really organize medications if you've got a bunch of pill bottles floating around. So the other advice I give to families is to make sure that if there's a medication that a patient's no longer taking, that gets destroyed using products like DisposeRx or whatever the other product choice is, or dropping it off to be destroyed at a pharmacy drop-off point. However you do it, I think getting rid of those medications is essential, partly because it creates confusion. You're trying to keep somebody on a regular schedule, and then especially a family member with dementia finds a pill bottle in a medicine cabinet, and it says take every morning, and so they take every morning without realizing that this is a medication that was discontinued 6 months ago, but they start taking it again. And then also, particularly when you're juggling family members and childcare, healthcare for everybody, it's hard to keep track of where those medications can be stored safely. And so if there's no reason to keep those medications around, and when they're no longer needed, and usually there's no good reason to keep them around, I would encourage people to get rid of them. Also in part to keep them out of the hands of kids. Especially caregiving for somebody with dementia, they may not know and may not remember that those medications are potentially toxic, and might forget to put them in a safe place. And so you wind up with medications floating around where they really shouldn't be. I think overall, my advice is to take care of yourselves, because you're not useful, you're not helpful as a caregiver if you're not taking care of your own physical, psychological, spiritual well-being. And everybody has to do that differently. You know, sometimes it's making sure caregivers get some time away on a regular basis. Maybe it's carving out a couple hours in the day where they don't have to think about caregiving things. Maybe it's getting physical exercise. Maybe it's going to church services a couple times a week. Whatever it is, you got to make a list of what is helpful to you and stick to it. You know, you're doing so much to help a loved one. You're so organized, thinking about when their appointments are, what medications they're taking, what medications they're not taking. You're doing all that for somebody else. Use some of that organizational skill and talent to apply to yourself. Be as religious about getting yourself some exercise, for instance, as you are about making sure your mother-in-law takes her medications every morning. So that's something that I think we always try to remind caregivers of. Sometimes caregivers listen, sometimes they feel guilty for listening. And it's also hard. It's really hard to take time for yourself, especially on a regular basis. I think most caregivers kind of sneak in exercise whenever they can, which is better than nothing, but it's really not the way to go. You have to be religious, you have to be organized. You have to put as much structure in taking care of yourself as you do taking care of a loved one.